Welcome. This is Cardiovascular System, the Heart Part A. So for this week, we're going to be doing the cardiovascular system. I'll have a small lecture on the Heart Part A, the Heart Part B, and then the blood vessels, so the vascular portion of the cardiac. And the thing is that I hope that you've gone through the PowerPoints before I lecture, because I tend not to read the PowerPoint slides, but to comment on them. So having said that, away we go. So basically the heart is about the size of your fist. It's above the diaphragm, a little bit to the left of the midline, and is protected by a pericardium, which is filled with fluid as a shock absorber, and your ribs. So this is showing you where it is with respect to the rib cage, and this is showing you the pericardium that is surrounding it and helping to buffer it from any blows. Okay, so here we have a cross-section, and what's important about this is the heart's a pump. It's going to have pacemaker cells that will allow it to excite itself. It's called autorhythmicity, and when the pacemaker fires, and the pacemaker, which we'll talk a lot about in the second lecture, is located right about here. It's called the atrioventricular node. And then it sweeps through and electrically discharges the upper chambers, or the atria. So the right and left atria contract at the same time. And then a second pacemaker in the atrioventricular node fires after that, and then the right and left ventricles contract at the same time. But the right side of the heart is all about pulmonary, and the left side of the heart is all about systemic. So going from right to left, here you have your superior and inferior vena cava, bringing carbon dioxide laden gas, venous blood back to the heart, and they drain into the right atria. And then you have the atrioventricular valves, which separate the two, and they will ensure that the blood moves forward and doesn't back up, so that you don't get regurgitation back into the atria. Rather than what would happen is that when the ventricles contract, the blood moves into the arteries. We tend to talk about the right atrioventricular valve as the tricuspid, and the left atrioventricular valve as the bicuspid or mitral valve. Then once your atria contract and move that blood into the ventricles, when they contract, then that's going to make the atrioventricular valve shut, and then the semilunar valve right here open. And then blood will rush into, in this case, the pulmonary artery. Then the pulmonary artery goes to the lung. You're going to exchange respiratory gases, and what comes back to the left side of the heart is going to be oxygenated. So the pulmonary veins right here bring blood back from both sides of the lung into the left atria right here. And then when that contracts, it moves it into the left ventricle, and the mitral or bicuspid valve prevents backflow. Then when you have the massive contraction of the left ventricle or of the right ventricle, blood is going to move for the left into the aorta, the largest artery of the body. And the aortic semilunar, sorry, I clicked too fast. The aortic semilunar is going right here. You don't really see it, just a little bit right there. The aortic semilunar then is going to shut so that the blood rushes into the aorta and continues to the rest of the body. Okay, now the atria. Now the atria receive the blood either from the vena cava or from the pulmonary vein. And the thing about the atria is that there actually are no valves. You don't have a valve that is going to be the gateway between the vena cava and the right atria, or between the pulmonary vein and the left atria. And this is not that important now, but when you take pathophysiology, it can be quite important, because things like congestive heart failure, you can have backup. And part of the backup to the lung is the fact that you don't have a valve there, so you cannot regulate it. But certainly what you can regulate is the blood going from the atria to the ventricles. Then you have the AV valves, and from the ventricles to the arteries, then you have semilunar valves. But more about that later on. So the ventricles are really the pumping chambers. They have the most muscle. The right side of the heart is not that strong because it doesn't have to pump that far. You've got your heart, you've got your lungs. It's not a big difference. But the left side of the heart is, especially the left ventricle, is huge, because it really has to push that blood with such force that it will supply blood, oxygen, nutrients to every cell in the body, from the big toe to the tip of your head. So the pump as such is really the purview of the ventricles, because they are going to have to meet the demands of the rest of the body, especially the left ventricle. Okay, so if diagrams confuse you, then this is a great, it's kind of like a flow chart about how blood passes through the heart. And this may or may not help. But here you have your right atrium, goes by your tricuspid valve to your right ventricle. Then that is going to get pushed past the pulmonary semilunar valve into the pulmonary artery and goes to the lung. Then the lung will exchange O2 and CO2. Pulmonary vein brings oxygenated blood back to the heart, the left atrium, past the bicuspid valve to the left ventricle, past the aortic semilunar valve to the aorta, and then to general circulation, arterial systemic circulation. And if you're a visual learner, which I am, then this might speak to you more, or in addition to. But what I like about this is it shows the right side and the left side, so that you see that you're getting blood coming back from the body to the right side. Then it pumps blood into the lungs so you can exchange CO2 and O2. Then that oxygenated blood is going to come back to the left side of the heart and then get pumped into the aorta, so that that will supply oxygen and nutrients to every cell in the body. So you have your pulmonary circuit, the lung, and your systemic circuit, the rest of the body. All right, so this goes into a lot of specifics about the atrioventricular valves, which I'm not going to get into on the quiz. And the big difference between the atrioventricular and the semilunar valve is really the shape of them and how they open and close. But what all valves do, no matter where they are in the body, is they prevent backflow. They will ensure the continuous flow in one direction, and that's the job of the valves. Otherwise, the heart would be so inefficient as a pump. Okay, so this again goes into more detail than I'm going to get into. The big thing that makes valves do what they do is pressure. So the pressure of the blood. So if you have an upper chamber where all of a sudden there's a lot of blood, and that's creating a lot of pressure, especially when the upper chambers contract, then that is going to open the valves. And then the AV valves will open and blood will go into the ventricle. But then when the ventricles contract, you want that blood to go into the arteries. You don't want that blood to go regurgitating back into the atria. So if the valves find that the pressure below them is suddenly quite great, quite large, like contraction, they'll shut. So the beautiful thing about it is that when your atria contracts, the valves open, blood rushes to the ventricle. When the ventricles contract, however, the pressure is so great that the AV valve snaps shut, and then the blood will go into the arteries, because in that particular case, the semilunar valves will open and then shut. So this is just showing you how that happens. I'm not going to get into any more detail on the modal quiz, except to say that pressure will determine whether or not the valves open or shut to prevent backflow. That's essentially what all of this is about, and that is the end of Part A. I will join you in a little bit for Part B, and Part B is going to be much more about how do you regulate the heart. How do you regulate its beating? How do you regulate its heart rate? How do you regulate how much blood is ejected, called the stroke volume? How do you regulate cardiac output? So I will see you soon.